Well, thank you for joining us, everyone. If you're turning 65, you have questions about Medicare or Social Security, you are in the right spot. You'll see me. I'm Jim. I'm way up in the upper left-hand corner. Please drop your Michigan hometown in the chat so we can say hi. Also, you want to grab a cheat sheet or a notepad. We want to take notes. Last thing, also, if we need to reschedule, click the blue calendar icon because once we start, don't leave or close the screen. It may restart on you depending on your updates on your computer. Occasionally, some folks will have trouble getting back in. So let's get started. You may have seen the ad for Jimmy Medicare. Well, that's me. I'm Jim Komorowski, and like a lot of folks here in Michigan, I've got a long last name. It's tough to spell, so we made it easy. So if you go to jimmymedicare.com, you'll land at the M1 agency. A little about me. I am an RSSA certified Social Security planning specialist. I've been in financial services and insurance for over 25 years. Born in Mount Clemens, I live near the Detroit Zoo. Very proud Michigander from over here. And again, very Michigan through and through. So a lot of people ask me, why the M1 agency? We'll want to give you a little backstory here. Really started before the pandemic, actually right at the kitchen table. And I watched my wife, Lisa, guide her mom, Beverly, through several surgeries, several hospital visits, and Medicare, thank goodness for her dad's Social Security benefits, but have to guide through all of that stuff, to get through it all. But even with good coverage with her, it felt like a full-time job. And as a Gen Xer from Michigan, I saw the need to get ahead, learn from the boomers to better serve our generation. Also, I wanted to give back when I started the business, and through Forgotten Harvest, we do. So that's when we built the M1 agency. It's a way to use my experience in insurance, mortgages, and fintech to help our fellow Michiganders plan Social Security smart before Medicare decisions ever come into play. So we do encourage you to follow the M1 agency on Facebook, Instagram, or LinkedIn to learn more. Please scan the QR code it's my full digital business card, email, phone, it's all there. We work around your schedule. Flexibility is what makes us work. So we can meet you by appointment in Bloomfield, or we'll even meet at the Royal Oak Chamber office. If you prefer Zoom or a phone call, again, that's the easiest. We can make that happen any time of the day. And if time allows, we're happy to come to you. So let's jump into original Medicare. Again, we don't have a ton of time. We want to keep this high level and keep it simple for you to understand. So the starting point for Medicare, it's always Part A and Part B. Again, great time to grab the pen and paper, take some notes here. It's important to understand which each of these covers. So Part A is hospital coverage, so your inpatient stays. This is free if you or your spouse worked 10 non-consecutive years or 40 quarters of coverage, as Social Security terms it. Part B is your doctor and outpatient coverage. That standard cost is about $185 a month. You want to make sure you jot that down because that cost is for everybody, regardless of their situation. So everyone has a different Medicare enrollment scenario. And before we meet, want to make sure that you figured out which one actually fits best for you. Scenario one, easiest one, you're already explaining your Social Security benefits. We'll explain why that's easiest here in a minute. Scenario two, you're not receiving your benefits and you've never made a Social Security account before. Scenario three, you're still working, you haven't even thought about Medicare yet, and potentially haven't set up a Social Security account. Don't worry, we're going to cover all these in detail. So write down this $185 figure, please, 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 please. Everyone pays it unless there's a special circumstance. So scenario one, if you're currently receiving Social Security benefits, you will automatically be enrolled in Original Medicare when you turn 65. And that's when you'll receive your ID card about 3 months after your birthday. But that's where that 185 will come out of if you elect to have it go that route. Now, if you're in scenario 2 or 3, this part is key, okay? You'll need to register for a Social Security account online to register for Medicare online, okay? We highly recommend you get this set up ahead of time. As a registered RSSA, we can help create the account with you, and also at that same point, help you identify the ability to optimize your benefits as well. You can still enroll in person, by phone, or in mail, but at the M1 agency, we strongly, strongly recommend you do it online for speed and for ease. Now, scenario 3 can be the toughest one. It's a very, very individual situation. There's no one size fits all here. Please make a note. If this is your scenario, okay, and you're still working, you're covered by your employer plan, you want to get your current plan together. and you want to compare it next to Medicare, because you can still enroll even if you have your employer coverage for Medicare coverage on your 61st birthday, but you may choose to delay Part B of your Medicare coverage until you retire and then elect to take the Part B at that time. So this one is a little bit trickier. And again, if this is your scenario, it's something we want to take a little more time with. So when does Medicare begin for most? It starts the month you turn 65, unless your birthday is on the first of the month. If that's the case, Medicare then starts the month before your birth month. This affects your initial enrollment period, your IEP. So this is good to know if you were born on the first of the month. Now, what does Medicare, what doesn't it cover? Sorry. Okay, so probably we hear this a lot. Wait, I thought Medicare covered everything. Not quite. If you have Medicare Part A and Part B only, you've got some major blind spots, okay? So Part A, for example, a day one hospital stay, you're going to have a $1,676 deductible for that hospital stay. Longer stays often can require daily copays as well. Now on Part B, the annual deductible is just $257, no big deal, but there is a 20% coinsurance with no cap, which is a huge risk on the Part B and the doctor's coverage, plus up to 15% in excess charges if the doctors don't accept Medicare rates. So there's some things to consider. It does not cover everything. So how do we cover the blind spots? Well, most people have heard of Medicare supplements and Medicare Advantage plans. And outside of self-insuring or staying on an employer or group plan, if you're eligible to, one of these two options is how 95% of people out there fill the coverage gaps in Medicare. So again, we want to take some notes here. Please take a look at the screen. This is key. This part's important, okay? There's really two roads that you can take through Medicare, and they follow a similar path. I always like to relate things to Metro Detroit, is where I'm at. Freeways here were built to match the old avenues, right? So the original spokes of the wheel, if you will. And original Medicare, if you look at please look at the visual on the screen here. Original Medicare, it's going to be like a freeway, like I-94, 75, or 96. Whereas Medicare Advantage, it's going to be more like Gratiot, or Michigan Ave, or Grand River, or Woodward. Okay. On either side, original Medicare, you're going to have that Part A and Part B, and then you can add Medigap, a Medicare supplement, okay, and your Part B. If you take the Medicare Advantage path, though, you're going to have to then worry about Part C, which is going to combine your Part A, your Part B, okay, and may or may not include Part D, which is the prescription drug coverage, which most Part C plans cover, and you may be able to, or you will likely be able to add if you're not covered by another one. So there's, again, a lot to work through, and everything's a little bit different. So let's compare the two options here. Please write these down on a Medicare supplement. Again, we're going to go back to the price. The $185 is what you're going to have on Part B no matter what. And then on top of that, you'll have the Medicare supplement cost. But with Medicare supplements, you can see whoever you want, wherever you want. That's key, okay? You pick your Part D drug plan still based on the prescriptions that you're actually taking, okay? Now, on a Medicare Advantage plan, you're still going to have the $185 a month for your Part B. Again, please write that down. Make sure, I really want to reiterate that and make sure that that's a covered thing here. But you do have more responsibility with this option to cover your blind spots. Copays, provider networks, max out-of-pocket limits, which we call MOOPs in the industry. But that also comes with extra benefits, which some folks find really appealing. Okay, so again, on the supplement side, Medigap, also known as Medigap, the Medicare supplement. More coverage, no networks, you pick your own Part D plan. Think of it like taking the freeway. Okay, on the Advantage plan, it's more like a highway or a country road or an avenue. You have specific doctors and hospitals that you'll deal with. Also, copays along the way, but it does come with extra benefits. So let's simplify this again. Supplement, you're going to pay more, you're going to get more coverage. Advantage, you're going to pay less, and you're going to take on more responsibility. Okay, more major exposures to keep in mind with Medicare. So no matter which path you choose, we strongly recommend coverage for cancer, heart attack, or stroke. These conditions always come with out-of-pocket expenses, and the amount and length of expenses are really dependent upon the treatment path. So with skilled nursing coverage, it's a very hot topic. We hear about this all the time, and it's another major exposure with Medicare. So the key takeaway here with skilled nursing coverage is that after day 100, you're responsible for the full bill. So let's show you what that looks like in the Medicare and You handbook. You'll notice here on section 2 of the Medicare handbook, this is from the website, and it all is broken down there. We can get this to you and get more detail, but we'll show you where to find this during the consultation. But you'll see on the right-hand side, the bottom paragraph, skilled nursing only kicks in after a 3-day hospital stay. And even then, the coverage is limited. Because of that, we at M1, we always recommend recovery care, and it covers you beyond that 100 days. And it helps eliminate one of your biggest exposures, okay? So for Michiganders, always like to break the umbrella coverages down into lanes. You can get that umbrella protection through either a Medicare Advantage or a Medicare Sup plan, okay? No matter which route you take, M1 is always going to recommend umbrella coverage to cover the blind spots. And just a quick touch on this for now. We'll go deeper on this near the end here. So let's look closer at the Medicare supplement. This is the plan for those that are okay paying a bit more monthly, and in return, you're going to get the freedom for the doctors that you can choose from, okay? So again, if you're like me and you hate waiting in lines, think of this as the freeway option. And we looked at these a little bit earlier. These are the major exposures with Original Medicare Parts A and B, and it's important to keep this in mind as you weigh your options. Now let's shift to the Medicare supplement. The Medicare supplement, also known as Medigap, it helps you fill in the gaps that Part A and B don't cover. So jumping ahead here to the supplement coverage plans, and these are all the same regardless of the carrier. We're just going to focus really on two because those are the two most viable in the marketplace these days, and that's the Plan G and the Plan N. The Plan G is as simple as it gets. Your only exposure is the $257 Part B deductible. Plan N also has the $257 deductible, but you could potentially face excess charges up to 15% or more on the 20% coinsurance. It's rare, but it's something to be aware of. The big question really just comes down to which one is right for you. So in Michigan, we would call this the Cadillac of Medigap plans, the Plan G. It's $100 to $200 per month, depending on what zip code you live in and the insurance company that you choose. But again, it's the Cadillac of plans. It's the top of the line. Now, just want to hit the highlights here. On Plan N, usually about $20 to $30 less per month than Plan G. And if you're leaning toward a supplement, it's either going to be Plan G or Plan N that you want to pair with umbrella coverage, okay? Now, as far as enrollment, the best time to enroll for a Medicare supplement, it's 6 months prior to your Medicare start date. That's when you're going to get the lowest premium. Then there's also plenty of time for you to review, make changes if needed. And really, one of the hardest parts of my job every day is just explaining this. Medigap policies are standard. So that Plan G is Plan G, Plan N is Plan N, no matter the company, be it Blue Cross, HAP, Priority, McLaren, United, you name the company, the Plan G is the same, the Plan N is the same, okay? So ultimately, what you're really shopping for with a Medicare supplement plan is price. The financial rating is very, very important because you want that price to stay locked in. And then customer service and the technology experience that you prefer. So here's a list of all the carriers we work with in Michigan. We work with all the major carriers in Michigan. There's even a couple more here that aren't showing yet that we've added. The point is, we really don't care who you choose from. We are carrier agnostic. We have them all. We would like to tackle here, too, a few myths that we hear out in the field all the time. So another thing a big thing that I hear all the time is that I got to pay a fee to use a broker to get help with all this, and absolutely not. In fact, that'd be illegal. We'd lose our license. We do not charge a fee to use our Medicare or senior health care services. Myth number 2, you'll see this a lot. We hear it all the time. If you're not charging a fee, nobody works for free, so the insurance company must charge you a higher price if I go through a broker like you. Absolutely not. You pay the same no matter where or who you enroll with. The carrier is required to charge the same price no matter who you enroll with, okay? What the carrier is looking for, they're paying us to make sure that you know how your coverage works and that the application is done correctly, saves them a ton of time up front, and what to expect when you are enrolled with them. So in the end, what you're really shopping for is just the best education, mix of education, choice, and expertise. That's ultimately, what we're trying to accomplish here. So if you paid, myth 3 here, if you're paid by the insurance companies, you must have less a bias towards one company or the next. And as I said before, this is completely false. All the companies are paying the same. There's no hidden advantage. Our goal at the M1 agency is to find you the most value for your premium that you're already going to pay. So again, just to recap this, 3 truths to using a broker. Truth 1, no fees charged for Medicare, any senior health services. Truth 2, the price you pay for the insurance company is the same with or without a broker. Truth 3, there's over 20 companies that we have to choose from. The number is constantly going up. We are not biased. We want to put you in the best coverage for you. So prescription drug coverage, I mean, it's just a complicated and not the funnest topic. It is very complicated. It's very individualized is really why. And because of that, I want to keep this, explain this conceptually and at a high level. Some calls we have are super quick, especially when the prescriptions are minimal. Others can take a long time because there's a lot to review within the prescriptions. So a great note to take here, if you have that pen and paper available, is to really start building an accurate list of your medications, the types and the prescribed amounts. That's key to find the best plan for you. Part D. So let's jump ahead here to the prescription drug coverage, the core of this, and it's known as Part D. You'll also hear it referred to as PDP, which is a prescription short for prescription drug plan. You hear it referred to both ways. So if you hear PDP or Part D, you know that is prescription drug coverage. Now, important note here, if someone doesn't have prescription drug coverage when they're first eligible for Medicare, they can get hit with a penalty. It's 1% extra for every month they wait, but if they have creditable, I always struggle with that word, creditable coverage from work or another plan, they're in the clear. So, Michigan Red Wing fans here, we all love Bob Probert, but no one wants that trip to the penalty box. No one wants to pay the extra 1%. Just make sure you sign up shortly after that coverage ends. So it's just something else, again, that you want to really, really, really make a note of. Now, our Part D process, this is key. Number 1, spend a lot of time with you up front. We correctly input the drug list into Medicare's online calculator into our software. We'll then choose the pharmacy, and then from there, compare all your plans and options that are available within your zip code. It's very specific to your zip code. And then from there, you can enroll in that plan of your choice and just reevaluate it on an annual basis. That's why you work with an agent, because that's the one thing, even with a Medigap plan, that can change year to year is your Part D. So it's something that you're constantly monitoring. The 3 pieces, Medicare, the MedSup, and PDP, are then, you want to cover these under an umbrella, okay? So if you're on a Plan G or Plan N, the PDP, the Part D, is something, like I said, you're going to constantly monitor that and watch it very, very, very close. So let's get into a Medicare Advantage plan. Now, a Medicare Advantage plan, I want to preface this, it's not necessarily more complicated, it just needs more planning. Remember, we're off the freeway now. There's going to be more stoplights, more pedestrians, more turns, more things to deal with. A Medicare supplement mostly requires prescription planning, but with a Medicare Advantage plan, you're going to need to plan for doctors and specialists as well. So a Medicare Advantage plan, I'm going to spend a little extra time on this one. Medicare Advantage plans, it's very important to note this. They are based on your zip code, and they can even change within the county, but they generally, they're going to change county to county. They're not as standard as a Medicare supplement. They're more personalized. And this is managed care. This is often what you're used to with a group plan. The government pays a private company to take over your Medicare, okay? So the setup is meant to save you money and manage the care locally. And again, I don't lean either way on these. My mom has an Advantage plan and brags about it. I have an uncle who loves his Medigap plan and would never switch. It's really, I'm a golfer. It's like telling somebody how to set up their golf bag. It's so personal. you can't really just make blanket statements with this. Now, the Medicare Advantage plans, these are the ones you're going to see advertised on TV, sometimes as $0 premiums depending on income. But don't forget, when you see a $0 premium, you're still going to have your Part B, okay? Hospital costs, they can include copays, deductibles, coinsurance, and MOOPs. Those are all associated that you're going to have with the Medicare Advantage plans. And that's why we always recommend the umbrella coverage on top of the Advantage plan. And remember, especially with an Advantage plan, they can change every year. So there's something you constantly want to review them, like that Part D. And, again, bottom line, and you again have that umbrella coverage on top of that. And that's really the bottom line here. You always, 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 always want to keep an umbrella plan if you go the Advantage route. So how do we pick that Advantage plan? I'm going to mix ideas here a little bit, but hang with me. Think of this like a waterfall that flows in order, okay? So when we're choosing a Medicare Advantage plan, it does take some planning. It's kind of like going on a road trip. And imagine that we're going into the UP. We're going to go to Tonquanemon Falls. It's a beautiful spot here in Michigan. And really, this is how the road trip would work, right? First, we're going to get in the right lane on the right-hand side, in that slow lane. And we're going to enter our zip code. And then we're going to move over to the middle lane. This is really where we're going to spend the most time. Okay, so that's where we're going to dial in our doctors, our hospitals, our medications. Do we have to make a switch at this point? And that's really, from what we're used to, that's when we may have to make that determination if we're selecting an Advantage plan. But ultimately, what we're trying to do here is move to that fast lane and and then that's when we can look at the extra benefits. So you'll see this on commercials a lot of times where when these advertisements are on TV, they're leading with the extra benefits like dental or gym perks. Those are the things you want to look at last. Extra benefits come last. We want to make sure everything else fits first so there's no surprises, okay? So with Medicare Advantage plans, you usually want to start the process about 3 months before you want coverage. Don't worry, you still have time, 3 months before your birthday before it's official to make adjustments if needed. And you can change your Medicare Advantage plan every year during AEP. So in the fall, from October 15th to December 7th, you can change that. And that's when you're going to see, just tons of commercials and your mailbox getting just bombarded with offers during that period. So again, still, please take a look at the notes that you've taken. Start filling in any blanks here. Medicare supplement, just to recap, Part B premium, $185 plus the supplement plan costs, the lowest out-of-pocket expenses when you're seeing doctors and hospitals. You can choose any doctor that is contracted with Medicare in the United States, no referral needed. You still have the Part D that you got to monitor. That's where you're going to choose a prescription plan from a standalone prescription drug company. Now, on the Advantage side, again, you're still going to have that Part B. I keep reiterating that, the $185 plus the cost of the Advantage plan. You'll have higher out-of-pocket costs when seeing doctors and hospitals. Okay, you'll have copays. So it's kind of a piecemeal plan. You pay for it each time you go. You have to choose specific doctors within the network that are contracted within the plan. And typically, the Part D is going to be included. So that prescription drug coverage is typically included. And then these Medicare Advantage plans will have the extra benefits that will include dental, vision, gym, over-the-counter benefits, groceries, et cetera, things like that. So again, no matter which plan you choose, we're always going to recommend umbrella coverage to protect against those blind spots we talked about earlier. And let's face it, in Michigan, we drive fast, okay? And with that in mind, we always suggest matching that to the fast lane umbrella coverage. Not everyone can afford the Cadillac payment in retirement, but you can have the Cadillac of healthcare plans for less than the cost of that typical Cadillac payment. And this includes that cancer, heart attack, and stroke. The fast lane umbrella goes further, though. It also adds home recovery to cover that home recovery care beyond the 100 days and cover that blind spot. Plus, you'll have the dental, vision, and hearing coverage. Now, some people don't need the fast lane coverage. The passing lane is fine for them. Costs a little bit less. It doesn't mean you're self-insuring everything. You are just self-insuring your recovery and home care after the 100 days at that point. But at the bare minimum, okay, if you're just going to stay in that right lane and go 5 under, we still recommend a cancer, heart attack, and stroke plan, and it will help fill crucial blind spots with your Medicare Advantage plan. So with the transition into Medicare comes a shift in how you manage your finances too. We're getting close to the end here, but before we finish, this is important to note because for many people, this is the first time they've ever paid healthcare premiums out of pocket. I make sure that I tell everyone going through this that what got you through the last 30 to 40 years is not going to work the same in retirement. So paying for healthcare out of pocket, it's a perfect example of that change. You're going to see, a big drop in income, and as a result, we want to focus on smart, sustainable income planning and protect your health and your wallet. Okay. So common retirement and liquid accounts that we see, most situations are very similar to this. Usually most people have money tied up in a volatile or market driven account, or although it's liquid, you have people that have a lot of money sitting in no growth accounts and it's losing a lot of value because of high exposure to inflation. So it's a great time to shift away from that and focus on safe money retirement, steady, protected, and built for peace of mind. So what is safe money retirement? It means you can still participate in the market just without some of the same, without the same level of risk. Okay. And there are several ways to build fixed income strategies, and think of it like a pension that you're creating for yourself. I encourage you to visit my LinkedIn page where I keep all my credentials and all my certifications updated in real time, so you can see, what we look at or how we put some of these together. And we're happy to send you any of this stuff, beyond the RSSA certification, that we discussed earlier. So again, it's very important that if as you're changing your mindset as you're starting to pay for those health expenses out of pocket. So we're almost at the end. Let's put all this together. So you've completed phase one. Thank you. And the M1, that's the Medicare education phase. The M1 agency online content, and we've got this, today's educational seminar, or seminar rather. Please, we suggest, there's a bonus item here that if you made it this far, we provide a RSSA roadmap report for those that need it for Social Security optimization with the promo code at the end of the webinar that we're going to share. So phase two of this, get the consultation set up. We'll discuss your specific situation, get the expert help in choosing the right plan for your area, for your life circumstances. Also, too, we do a personalized Medicare roadmap and cost summary, a step-by-step action guide to outline all of your monthly costs so you can figure out exactly what this is going to look like for you. And then just in working with us, and this is really phase three, you have lifetime billing and claims assistance. We're always here for you. We pride ourselves on checking in with you when you get your ID cards, birthdays, holidays, when rates changes. You'll have no shortage of help from M1. And then the big thing is the free annual review. You'll work with us, whether it be just that Part D that you're reviewing or reviewing the Medicare Advantage plan year to year. Bottom line, we want your first resource for anything that's related to this kind of stuff. We want to be your first resource for that. So if you live in Michigan or you're watching this on behalf of someone that is, you're confused about Social Security, you're turning 65 in the next 6 months, you're getting ready to retire, please let the M1 agency be the local option that we discuss this first before you're getting on the phone and calling a paid celebrity on TV. We've got the 2 bonus items waiting for you. Just use the promo code provided. You can see the promo code. It's opening day, so please provide that to us when in our first call, and we'll get you that Social Security roadmap set up. And please click the blue calendar to schedule your consultation. We were trying to keep this under 30 minutes. I think we're going to be just shy, it looks like. So thank you for spending 30 minutes with us today. We hope it was informative, and we really, truly look forward to speaking with you soon and can't wait. Thank you so much for your time.